counties in the metro area all have a clear vision in mind, a collective reopening before the summer begins. The state is hitting pause on administering the Johnson & Johnson vaccine, while taking it out of rotation for the time being is supposed to enhance confidence in the vaccine down the line. Following the country's most recent police shooting of an unarmed black man, we look at Colorado's recently passed police reform law for answers to a problem not going away. The world needs more nurses. Students wanting to be nurses can't do it online only, so let's load up the training and go mobile. And will Colorado Muslims have to break fast to get the vaccine? Answers to questions you weren't even thinking about. Next. May 16th is the day metro area counties are in the clear, level clear. 6 metro area counties will allow 100% capacity at businesses on May 16th. The state's ever-changing color dial will go away on Friday, and on that day, Denver, Boulder, Broomfield, Jefferson, Adams, and Arapahoe counties will all move together into a 2-phase plan. You'll notice I didn't say Douglas County on that list. More on you folks in Parker, Castle Rock, and Highlands Ranch in just a moment. For the other 6 counties I listed from the metro area, Phase 1 is moving to one level below what you're seeing right now. For most of those 6 counties, that will mean moving to level blue. Arapahoe County is already at blue, so they will move to green. Level blue means things like 100% capacity at restaurants and gyms, as long as social distancing is being practiced. Offices can operate at 75% capacity. Indoor concerts with no seating could have a capacity of 50% or 175 people. And last call moves to 2 a.m. Phase 1 will run through May 15th. And then the next day, May 16th, those counties would shift to Phase 2. What they're calling level clear, where there are no capacity restrictions, just perhaps indoor mask requirements. County health leaders say this approach will allow for caution while also helping slowly bring back the sense of normalcy that everybody wants.
We think this regional approach will do 3 things. First, it's going to give us an extra month to provide more of our residents with vaccinations. Secondly, we think it's a smart approach, balancing thoughtful caution with our desire to fully reopen. And third, we think it creates predictability over the next several months and consistency across a region in which our residents cross county lines regularly for work, social matters, shopping, et cetera, et cetera. And then, of course, finally, we really think this is going to be a path to get us back to where we all want to be, which is safely and fully reopened.
So what's going on with Douglas County? County commissioners just voted today 3-0 to not abide by the future public health order of the Tri-County Health Department. So once the state health order goes away on Friday, Douglas County could move to 100% capacity, but that won't impact things like mask orders still in place by the state. The health departments in the other counties say they'll monitor hospitalizations between mid-May and mid-August, and if the hospitalization rates go up, the health departments can bring back some of the capacity limits over those 3 months. This unified front may cause some jurisdictional headaches in Westminster. City Council there voted to get rid of the mask mandate last night, saying the order was, quote, outdated. Tri-County Health and Jefferson County Public Health both updated their orders to remove the outdoor mask requirement, but the indoor one is still in effect. To make this even more confusing, since Westminster is in Adams and Jefferson counties, people in the city will still have to follow county rules and wear a mask inside. It's been a rough couple of weeks for the J&J vaccine in Colorado. You had a dozen adverse reactions last week that shut down the mass vaccination site at Dick's Sporting Goods Park. Now today, the FDA suggested providers stop giving the shot because of a rare issue with blood clots. Well, today our Steve Steger learned Colorado doctors are trying to figure out if a patient here was impacted by that. And Steve also asked health experts and the governor, how do you keep people confident in the vaccine?
These are really rare events that we're seeing.
Really rare. We're talking less than 1 in a million for now. Of the 6.8 million people who've received the vaccine from Johnson & Johnson, 6 of them had this rare blood clotting issue, something the FDA is now investigating.
What naturally follows is more cases. Hospitals will start saying, hey, we may have something like that here.
Colorado's chief medical officer, Dr. Eric France, said none of the 6 cases listed by the FDA this morning were from our state. We did learn there is one possible case in a Centura hospital.
We do have one individual patient that we're still investigating that is in a hospital at this time. We can't give any more information than that.
It's not the first time J&J has been in our newscasts. Less than a week ago, we were talking about 11 people who got the vaccine at Dick's Sporting Goods Park who had adverse reactions, shutting that vaccine site down for the day. Another rare issue, but Centura's CEO says his staff is trained to be cautious.
They've embraced a culture of safety where it's see something, say something, and everybody can stop the line. We have to listen to on-the-ground clinicians, physicians, nurses, and caregivers when we see something wrong.
That level of caution, he says, should instill trust.
It's important for health systems, the state and federal government to be completely transparent and accountable around these issues.
The FDA expects to have an answer to this latest problem in a matter of days. Governor Polis believes the vaccine will be back, and when it is, he has a message to keep people confident.
COVID-19 is several orders of magnitude more dangerous than the limited reporting of any of these incidences of side effects from vaccines.
So what does this mean for you? The FDA warns that if you got the J&J vaccine within the last 3 weeks and you start to experience severe headaches, abdominal pain, pain in your legs, or shortness of breath, you should call your doctor right away. If you have a J&J vaccine appointment in the next few days here in Colorado, you might expect that your provider might get you Moderna or Pfizer instead. Marshall, right now the state is working to move that supply around so they don't have to have people giving up appointments if they were supposed to get Johnson & Johnson in the next few days.
Gosh, Steve, we're back at that intersection of medicine, public health, people who aren't very knowledgeable in these areas because that's not their expertise, and having to trust, look, it may sound bad, but in the end, it won't be bad. I know you'll stay on top of this. Thanks, Steve. Almost 22.5% of our state's population has now completed the vaccine process. That's more than 1.3 million people. 846,000 people are still waiting on their second dose of Moderna or Pfizer. And there's that gray slice that represents the 20% of Coloradans who are younger than 16 and are ineligible for the shot. These next numbers aren't as great. Hospitalizations still going up. 439 people are currently hospitalized in Colorado. That's up 10 from the day before. And it's the highest single-day number we've seen since mid-February. This time last week, 374 patients were being treated for COVID-19 in Colorado's hospitals. And then the positivity rate, a big jump in single-day positivity rate yesterday, 7.8%. Hopefully that's just a one-day blip because it seemed, at least for the moment, that our positivity rate, that is, had leveled off. Our 7-day average is 5.6%, the highest it's been since the end of January. We are now well above the 5% threshold we need to be, under at least, for the virus to be considered, quote, under control. When Colorado lawmakers passed a police reform measure last June, part of it was to start gathering data which might reveal racial inequities. Are certain drivers pulled over more than others, and for what reason? It's a question being asked yet again following the traffic stop in Minnesota that resulted in a police officer shooting and killing Daunte Wright, and following the video that's been widely shared of a December traffic stop involving an Army lieutenant in Virginia. Colorado's police reform law will require law enforcement agencies to track the demographics of people contacted by law enforcement. Was it a traffic stop? Did that contact end in a warning or an arrest? Did the officer take their weapon out? Not just use it. Did they unholster it? Law enforcement agencies in Colorado will have to start tracking that information starting in July 2023.
The data collection in Senate Bill 217 is extremely important because we can see where communities are being overprofiled and where we're seeing bad outcomes. We know that if a person of color were stopped versus a wealthier white person were stopped, that the outcomes are different. But folks are saying that that doesn't exist. And so what this bill does is it requires that data reporting. And I'll be clear with you, there was a bit of opposition from law enforcement from even collecting and tracking that data. And we think that's hugely problematic. We need to know where there is, if you will, a pattern and practice of abuse by law enforcement so that we can step in and make changes, or so that those departments can step in and make the needed changes.
There's another aspect that's going to be required by that law, a searchable database of officers who resign while being investigated for violation of department policy or excessive use of force or lying. That database will go live in January. A quick note about a state senator's emotional story yesterday. Just before the passage of a bill requiring safe storage of firearms, Centennial Democrat Senator Chris Colker told a personal story of depression in the 4th grade, grabbing a gun from his dad's case and contemplating suicide. He told his mom what he did and said the gun case has been locked ever since. We played that sound for you yesterday. Then we paraphrased what he said next. How years later a teenage student of his had access to her family's unlocked guns and wasn't able to stop herself. He never said what happened, but when we paraphrased that story, we said the teenager wasn't able to stop herself and took her own life. That is not how the story ended. We found out she was injured, but survived. Ramadan means daily fasting. Is it still safe for those who observe to get a vaccine while going without food or water? Or do they need to wait until the holy month is over? The impending winter weather has some of you prepping the plants and has Corey prepping his poetry. Next.
Mostly cloudy and cool for much of the day, but some afternoon sunshine in Denver and Fort Collins allowed temperatures to warm into the lower 50s. Don't get used to it. Colder air is coming in tonight and another round of rain and snow, and that will be the theme for the rest of this week heading into the weekend, with the best chance for accumulating snow coming in Thursday night into Friday. Overnight, very little, if any, accumulation in Denver, but there is a winter weather advisory for the Front Range foothills and northern and central mountains for 4 to 8 inches of snow. Winter Park, Breck, down to Evergreen and Conifer. Again, maybe a little bit of rain or snow, maybe some slush on the roadways, a ½ an inch on the grass, and then by Thursday evening, a little more foothill snow, but Denver's really not going to see the best snow until early Friday morning. 33 will be your low tonight with cloudy skies. Rain and snow come to an end. We get another round of rain and snow showers tomorrow night, and it looks like Thursday will be the mildest day with sunshine for a little while, enough to get us to 51, and rain showers. But it's Thursday night into Friday. We get that 2 to 4 inches of snow. If it's going to be a rough drive, it'll be Friday morning, and then drying and warming as we head into the weekend with highs near 60 for Sunday and Monday.
Tell me you've lived through a lot of springs in Colorado without telling me you've lived through a lot of springs in Colorado. These folks in Sunnyside know what's up. With the unpredictable weather this week, they've got to protect their tulips somehow. So it's plastic bins over the flowers with rocks on top to keep them stable. It's simple, but effective. The one predictable thing about the weather in April is that it's unpredictable. They are prepared for the changing weather later this week. So is 9 News meteorologist Corey Reppenhagen ready? I'm not talking about his garden. Is his poetry ready? With the freeze on the way and all of our precious vegetation at risk, he put pen to pad today because everyone knows that practice makes perfect.
Corey Reppenhagen is on the weather beat.
Spring flowers have brawn. Pastel and white, pure April. Don't hurt the peaches.
That was Corey Reppenhagen on the weather beat.
The holy month of Ramadan has begun, which means Colorado Muslims will be fasting from sunrise to sunset for the next month. They may also be getting vaccinated. We were curious if fasting could enhance the possibility of vaccine side effects. Colorado, heck, America. The world needs more nurses. For students in Colorado, the necessary training and clinical hours fits nicely in a U-Haul. That's next. Glasses on a dog, not good. When was the last time you thanked a nurse? They're the backbone of our healthcare system. Over the last year and few months, nurses have had a weight on their shoulders that none of us have felt before, a global pandemic. It also doesn't help that currently there's a shortage of nurses across the entire U.S. Destinations Career Academy of Colorado is hoping to do something to shrink that shortage. It's innovative here. The Academy in Westminster is a mostly online school with students pursuing careers throughout the nursing field. The school, unfortunately, has limited in-person capabilities because of the pandemic, so they're using a pack-and-go method using a U-Haul van. They pack all of their training equipment and go and unload the equipment on site and pack it up again when they're done. Recently, they received $60,000 in funding for a mobile nursing lab. Essentially, it's a nursing RV to bring hands-on education to their remote students who live across the state. K-12 students at the Career Academy, along with students from Julesburg Public Schools, will be able to receive industry-level training and complete clinical hours. It'll go a long way to preparing the next generation of healthcare workers.
The purpose of this, they can learn the curriculum online, but for them to be able to really practice the skills, and that's what the preclinicals is all about. They're actually in there using industry recognized standard equipment, medical supplies, and they are practicing as if they are currently a CNA and really practicing those career skills and mastering them.
Destinations Career Academy of Colorado hopes to have the van traveling to their students by September.
Ramadan has begun. The holy month for Muslims means a month of self-sacrifice and prayer. With that comes a month of fasting from sunrise to sunset each day. That got us wondering, how does that play into vaccinations? Should people who observe Ramadan avoid getting vaccines for the next month? Or is it safe to get the shot while not consuming food and water? For an answer, we turn to Dr. Omar Mubarak.
There have been no recommendations regarding food intake or liquid intake while getting vaccinated. And so just looking at the medical literature, we would assume that there is no reason a person could not get the vaccine while fasting. If a person who is Muslim gets vaccinated and they experience symptoms and they need to stop for one day, that is fine. What they would do is at the end of Ramadan, they would just repeat a day of fasting and it would still complete their month of Ramadan.
We were also interested to know if there would be an extra consideration for Colorado Muslims when it comes to vaccine clinics. Like, do any clinics need to be planned for after sundown to accommodate people who are fasting during the day and not wanting to interrupt that fast? We emailed the state health department multiple times. We're still waiting for a response. A reminder about the importance of bear-proofing your trash cans. It's the most Colorado thing we saw today, plus your feedback next. The most Colorado thing we saw today is a bear coming out of hibernation and going straight for your trash. Gina sent us this photo from Highlands Ranch saying, the bear problem started a bit early this year, but he's still a little sleepy. Good news is he just couldn't get into the trash, so he took a nap on top of the cans. In case you were curious, bears, the real kind, have started to wake up in our state. Colorado Parks and Wildlife tells us they're typically active from mid-March through early November. They did not have data on bears of the stuffed variety, but we assume March to November. That's pretty similar. Getting your feedback on Douglas County going different than the rest of the metro area counties. Kim says it's like living in the Hunger Games in Dougco, staying out of restaurants and crowded places, while Wendy says, thank you, Douglas County. Love my commissioners. And Mark tells us, thanks for making a big deal about J&J vaccines. It'll impact 1/10,000th of people in Colorado. Mark, it's not about fear. It's about facts, not fear. People can be scared right now, and we want to make sure they have all the information they need, no matter what vaccine they're going to get. We'll do that again next time.